The CDC says more than 2.5 million cases of chlamydia, gonorrhea, and syphilis were reported in the U.S. in 2022.
Yeah, syphilis actually accounts for more than 200,000 of those cases. TV6's Joshua Blount joins us now. And Joshua, what does this issue look like locally?
Well, Redrick and Morgan, according to the Iowa Department of Health and Human Services 2022 data report, among 565 men tested, 64% were positive for syphilis. Meanwhile, among 312 women, 36% were positive for the sexually transmitted infection. Local health professionals say they are working to get those numbers down. Syphilis, a sexual transmitted infection, is raising concerns for health professionals.
Over the past 5 years, syphilis has increased not just in Scott County, but across the country.
According to a 2022 report from the Iowa Department of Health and Human Services, the highest rate of syphilis in the state is seen among people between age 30 and 34, about 90 cases for every 100,000 people. LaShawn Moore, Clinical Services Manager for the Scott County Health Department, says no one is exempt from contracting syphilis.
Individuals that might be at a greater chance of getting a sexually transmitted infection, including syphilis, certainly can be your adolescents, your teens, individuals that have men who have sex with men, your pregnant women certainly want to be tested to make sure that they don't have syphilis, because they can pass syphilis to their unborn child.
Those who contract it can experience different symptoms at different times.
The first stage can be a sore called a chancre, but a lot of times that's missed because it can be in places where people can't see it. And then individuals can move on to the secondary stage, which can cause a rash. And typically that can be a reason why people would seek out care for their providers.
Overall, Moore says it's best to use proper protection and to make sure your health provider is doing their part.
It's just really, really important that providers have that discussion, with their patients, when they're coming in for care, and just asking if there is a need for testing. And then also for pregnant women, that they are screened early in their pregnancy.
I checked in with the Mercer County Health Department, who says they have not seen an increase in syphilis cases. I also checked with the Rock Island County Health Department, but no one was available to speak with me today. Redrick.
All right, Joshua, thank you. Now, health experts say without treatment, syphilis can lead to other health concerns affecting things like your heart, your vision, and your hearing.